Hello, this is Dr. Carol Motley, Associate Professor in Family Medicine here in Mobile at the University of South Alabama College of Medicine. The following webcast focuses on the theme of enhancing patient education. Why spend the time it takes to educate patients? There are several very good reasons. If you look at the causes of premature death in our country, the largest reason is unhealthy behaviors. 40% of premature death could be prevented by developing healthy lifestyles. Behavior can be modified, however. It takes the patient to be engaged and motivated to make change. Patient education about consequences of their behavior is the first critical step towards making change. This requires appropriate and targeted medical education. Sure, the patient knows they need to quit smoking, but what are the risks to continuing smoking? And how does one begin to stop smoking? The obese patient knows they need to lose weight, but most are unaware of the composition of a healthy diet or what a healthy portion is. The following projects that will be presented have focused on the most significant behavioral health problems in our country. Patient education projects such as these are critical to improving the health of our nation. These are projects that I believe should be continued and developed further. Seeing the hard work and dedication of these scholars leaves me with gratitude and hope for the leadership of the future. Please listen as they share their passion and commitment to making a difference for patients through their projects.
Hi, my name is Chelsea Conrad. My community health site was Central Mississippi Health Services, located in Jackson, Mississippi. The name of my project is called Food for Thought, the DASH Diet. For my background, I'm from Baton Rouge, Louisiana, and in the fall I'll be a second-year medical student at Morehouse School of Medicine. DASH Diet. What is it and why is it important to CMHS? The DASH diet stands for Dietary Approach to Stop Hypertension. It is a dietary lifestyle change to lower the risk and help manage certain ailments such as hypertension, kidney disease, and certain cardiovascular diseases. It's a two-phase diet. During the first phase, which is 2 weeks, it focuses on consuming proteins and non-starchy vegetables, no sugars, no fruits. And this phase is also known as the weight loss phase. The second phase incorporates fruits and grains into your daily diet, and you focus on low-carb meal plans. For my proposed interventions, I created a patient packet handout, a resource binder for the clinicians, and a video to play in the reception area. I was also supposed to create a web page on the clinic website, but due to time constraints, that task was not executed. For my methodology, for research subjects, I had 32 patients, and the criteria to participate was that they had to be over the age of 18, made at least one medical visit during the reporting period, and at least 2 medical visits ever to Central Mississippi Health Services. And for my data collection, it began during week 4 of the externship, with data collection extending over a 1-week period. There were 10 questions multiple choice for the pre-test and 10 question multiple choice for the post-test. And the post and the pre-test consisted of the same exact 10 questions. For the pre-test, there were 32 participants. Patients had the most difficulties answering question number 2, which is a normal blood pressure reading. Only 6.25% of the participants could answer that question correctly. They also had trouble with question number 3, which is how much sodium should a person with high blood pressure consume daily. Only 12.5% could answer that question correctly. They also had trouble with question number 4, which is how much sodium should a person without a history of high blood pressure consume daily. Only 12.5% was able to answer that question. And lastly, question number 9, how many phases are in the DASH diet? Only 9.4% can answer that question correctly. When comparing the pre and post tests, there was a great increase in knowledge when it came to question 2, 3, 4, and 9. On question 2, there was a 43.8% increase in knowledge. On question 3, there was a 44.2 increase. On question 4, there was a 40.8 increase in knowledge. And on question 9, there was a 44% increase in knowledge. For my recommendations. 1. Patients respond more to oral presentations rather than packet handouts. Secondly, monthly classes should be offered to the patients so that they can learn more about health and nutrition. And lastly, there should be incentives for patients, maybe for coming to those monthly classes, such as pedometers, or maybe little meal handouts.
Health market research, the use of a needs analysis to create tailored educational infomercials, by myself, Falami Duncan, at the PCLP site, Southside Medical Center in Atlanta, Georgia. Southside Medical Center was interested in developing educational infomercials which would increase patient awareness of the various programs and services offered at the medical center. In efforts to design and implement an effective marketing plan, the purpose of this project was to perform a needs analysis to gain further insight on the demographics, beliefs, and behavior of the target audience. The findings would then be used to create a pilot educational infomercial which appealed to the needs of the intended audience. The methods used to carry out this study were that we first began by developing a 20-question survey to assess patient demographics, patient satisfaction, and opinion on various marketing strategies. Next, we then administered the survey in the different waiting rooms at Southside Medical Center to 32 patients who were willing to complete the survey. The data was then analyzed using Microsoft Excel to generate frequencies and percentages of the various variables on the survey. Lastly, the key findings from the needs analysis was used to develop an infomercial marketing the weight management program at Southside Medical Center. The key findings from the needs analysis showed that the majority of participants were African American and lived below the federal poverty line. Overall, most patients reported being satisfied with the quality of existing support services and counseling provided by physicians. Despite the overall satisfaction with the quality of services, there was a significant amount of patients who felt that more services were needed. These results proved that there was a need for improved marketing efforts. Interestingly, opposite to another study hypothesis, most patients did not use social media as a source for medical information, and more than 70% preferred to receive medical information from a physician or other medical provider. The data gained from the needs analysis led directly to the initial marketing strategy and development of the pilot infomercial. The data also helped to validate and modify the existing marketing approach based upon patient feedback. In the future, Southside has committed to continue using health market research to help ensure top quality and effectiveness of future marketing campaigns. Recommendations. In the future, it is recommended that Southside conducts a focus group to gain feedback on the final infomercial. Secondly, it is recommended that Southside displays the infomercial on the SMC website in order to reach a broader audience. And lastly, after the internal marketing efforts are completed, it is recommended that marketing efforts be expanded to external sources such as local TV and radio stations and billboards in the local community to increase community awareness of all the programs that Southside has to offer. Thank you. Bye.
Good afternoon. My name is Kayla Ibidapo from Morehouse School of Medicine, and I had the unique opportunity this summer of working at St. John's Well Child and Family Center located in Los Angeles, California. And this summer, my project consisted of me conducting a preliminary cost and quality outcomes analysis of the diabetes education program here at St. John's. My overall objective was to analyze the costs and financial investments placed into the program and equally analyze the quality outcomes of the diabetes education program to ensure that the goal achievements and the overall purpose of the class are being met to justify continued funding for the program. Initially, before really diving into this project, it was necessary that I conducted a literature review just to increase my overall basic understanding of alternative models to healthcare, the business aspect of medicine as far as cost and financial analysis, payer service operations, payer reimbursement models, and the annual successful revenue income for the diabetes education program offered here, as well as other clinics for comparison purposes. After conducting my literature review, it was necessary that I conducted key informant interviews with the Chief Financial Officer, the Chief Medical Officer, the coordinator of the diabetes education program, as well as the billing coordinator here at St. John's. I met with the CFO just to gain a cost breakdown and to receive a proxy preliminary Excel spreadsheet of a normal clinic visit to compare that to the cost investments of a routine visit seen through the diabetes education program and just the overall financial operation aspect of the diabetes education program. I met with this Chief Medical Officer to gain better understanding of the payer services, the payer mix of the diabetes education program, the target population of the diabetes education program, as well as understanding how the organization, seeing as St. John's is a federally qualified health center, how they receive funding to conduct these various alternative models to care. I found that through HRSA, as well as grants, as well as reimbursements from the payer services is how St. John's receives most of its funding. After conducting my key informant interviews, I was responsible for analyzing the patient files that I received from Dr. Sham Dasgupta, who is one of the lead provider coordinators for the diabetes education program. He provided me with a roster so that I could analyze the overall quality outcomes of the patients who regularly attend the program over the past year. After analyzing these patient files, I came to find that the overall hemoglobin A1C levels was decreasing, as well as the average fasting glucose levels over a 12-month period was also decreasing. This is one of the primary goals of the course, seeing as the course was designed to increase the self-manageability of the patients who have uncontrolled diabetes, as well as ensure that the average fasting glucose and the overall hemoglobin A1C levels are also decreasing. After realizing that the goals of the program are being met, I found that the payer mix is predominantly MyHealthLA, which is a program designed for low-income families to receive adequate health care free of charge. However, the organization does not receive enough reimbursements through patients who are MyHealthLA. However, the population for the diabetes education class is predominantly MyHealthLA. So with this being said, the program is designed as an alternative model to provide adequate care to uncontrolled diabetic patients to help them gain control of their diabetes. While the program does not elicit enough reimbursements, the quality outcomes of the class are being met. And so with this, if the Center for Medical Services, which controls all of the insurance provider care for patients in the Los Angeles area, can move towards value-based payments, the diabetes education program would be more fiscally viable. Thank you.
Hi, my name is Andrea Lewis, and my project is entitled Utilizing Social Marketing to Increase Interest for Southside Medical Center's Weight Management Program. My project was completed at Southside Medical Center main campus in Atlanta, Georgia. The prevalence of obesity in the United States increased during the last decades of the 20th century, with more than one-third of adults identified as obese between 2009 and 2010. Underserved and low-income populations are at a considerably higher risk for obesity. Thus, primary care providers, and particularly community health centers, are at the front lines of this epidemic. Community health centers that aid the underserved and low-income populations present an ideal setting for weight management programs, as they offer continuity of care in addition to multidisciplinary teams that can provide nutrition and health education. To combat the aforementioned challenges, Southside Medical Center is beginning to cultivate their own weight management program, which will ultimately be part of their comprehensive health awareness program. The purpose of my project was to utilize social marketing principles to help advertise and assess how likely patients were to sign up for Southside Medical Center's weight management program. In order to complete the project, I designed and created a trifold brochure based on previous research and the health behavior theory for the weight management program. After completing the brochure, I recruited adult medicine patients during their visit to read and get their feedback regarding the attractiveness, credibility, comprehension, persuasiveness, and usefulness of the brochure via a 20-item questionnaire. Surveys were then evaluated to identify any major concerns found in the brochure that needed to be modified. Key findings included majority of respondents identified the main idea of the brochure was the medical consequences of being overweight. Almost all participants were fond of the pictures found throughout the brochure. However, there were some suggestions to make the pictures more relatable to the wide audience Southside Medical Center serves, such as skin tone, size, and ethnicity. Only 5 of the 25 respondents indicated the brochure made them want to join the program. A majority of the respondents indicated the program costs should be free. So after reading the questionnaires, I went back and edited the brochure to supplement the suggestions given by the participants. A couple of the changes included adding sign up now boxes throughout the brochure to reinforce we want people to sign up for the program, and also changing some of the pictures to depict a more varied population. This project was able to use social marketing to develop tangible material to use to promote Southside Medical Center's weight management program. While this project involved a relatively small number of participants, further research should be conducted with a newly designed brochure and a larger number of participants. In addition to the use of the brochure to market the new program, other mediums should be used to reach more patients, such as social media like Facebook and Twitter, and utilizing the TVs in the waiting rooms by playing videos about the program. Once this program is up and running, the same marketing blueprint can be used for future programs. Thank you.
Greetings. My name is Tedra Thomas. I am a medical student at Morehouse School of Medicine. This summer, I have the pleasure of serving at Central Mississippi Health Services in Jackson, Mississippi. My project is entitled The Creation and Implementation of a Diabetes Self-Management Education Tool. My project objective was to create an educational tool that helped patients gain knowledge on diabetic self-care behaviors. These behaviors include, but are not limited to, healthy eating, blood sugar monitoring, being active, reducing risk, and problem solving. My methods was split into 2 parts. Part 1 consisted of weeks 1 through 4, in which I shadowed Central Mississippi Health Service physicians to get a feel for patient demographics. I also used this time to research diabetic self-care behaviors and create a DSME tool which consisted of a flip chart book of diabetic self-care behaviors. Part 2 consisted of weeks 5 through 6, in which I identified patients with type 1 and type 2 diabetes through the EMR, the electronic medical record system, with the assistance of a physician. When patients came in for their clinic visits, I asked for permission to perform the confidence level surveys to gauge how confident patients were on managing their condition. In addition, patients were given a pretest to assess their beginning knowledge level of diabetic self-care behaviors. I then conducted individual sessions with the flip chart book I created to educate patients on these diabetic self-care behaviors. After the individual educational sessions, patients were given a post-test to assess the knowledge gained. I found that there was an increase in patient knowledge gained as shown by the measurement of number of correct responses on the pretest in comparison to the post-test. Due to limited time in a small sample size of patients, I recommend that there be a longer data collection period to increase patient sample size. And lastly, a longitudinal survey to study the impact of these educational sessions on patient outcomes.
Hi, my name is Amber Waters, and I'm a medical student at Morehouse School of Medicine. My PCLP site placement this summer was at Spring Branch Community Health Center, located in Houston, Texas. The title of this study is the Joint Commission in Primary Care Medical Home Standards, Evaluating and Improving Compliance of Community Health Centers and Patient Self-Management. The objective of this study was to increase patient self-management education and also to increase the use of self-management tools. The research objective originally included an additional 2 objectives, one being to increase enrollment in the patient web portal, and 2 being to increase documentation of advanced directives. After delving into the project, it was decided that self-management would be the focus of the study because it required more attention and also because it would be more beneficial to the patients. The details about these last 2 objectives can be found in my full research write-up. Methods included observation of the flow of the community health center, interviews with medical assistants and providers, pre- and post-assessment surveys inquiring the medical assistants about their understanding of and their involvement with discussing self-management. Additionally, the medical assistants were giving a training session about self-management coaching for patients, and all self-management education materials were collected at each Spring Branch Community Health Center location. Some of the key findings for this study were that the medical assistants neither discussed self-management with patients, nor were they trained to do so. We found that after formal training, the medical assistants felt more comfortable with discussing self-management. Self-management education was either absent or inconsistent, so patient self-management tools were developed, and also self-management education folders were created so that self-management education could be streamlined across all 3 locations at Spring Branch Community Health Center. My recommendations for my community health center are to implement rooming procedures for patients with chronic diseases and conditions. For example, after a patient is diagnosed with hypertension, the RN will go over the self-management education folder for hypertension with that patient. And at the next visit, the medical assistant will help the patient to set self-management goals and also ask them about their progress with their self-management goals. Secondly, I recommend that a self-management section is added to the electronic medical record for better documentation of self-management. This will help the providers and possibly the medical assistants to document self-management. It will be useful for Spring Branch Community Health Center to adopt the ambulatory obstetric core care pathway in regards to prenatal self-management education, which provides cohesive information about which information to discuss or hand out at each prenatal visit. And finally, I recommend that Spring Branch Community Health Center begin a standardized training for all medical assistants to ensure that medical work is aligned with the way that Spring Branch Community Health Center operates. Thank you.
Hello, my name is Eric Zuniga. I am a rising second-year medical student at the UC Irvine School of Medicine. I am a GE PCLP scholar at HealthPoint in the city of Renton and state of Washington. I was tasked to evaluate the recently launched pharmacy mail delivery service. The mail delivery service is a free-of-cost option for patients to get a prescription refill via the U.S. Postal Service instead of having to pick it up at the pharmacy. This was spurred after the closure of the HealthPoint Renton pharmacy. There was a successful transition of patients into using mail delivery. Why have a pharmacy mail delivery service? A 2010 Kaiser Permanente study found that patients who used a mail order pharmacy instead of a local pharmacy for new diabetes-related medications, were more likely to have good medical adherence. A follow-up study in 2011, also by Kaiser Permanente, found improved cardiovascular disease risk factor outcomes when patients used a mail-order pharmacy. To increase patient awareness, first, I had to understand how the system works. I observed medical assistants, providers, and pharmacists and asked for their opinions on the service. To get the patient perspective, I conducted a phone survey of patients currently using the service. Most staff members were borderline between being aware and unaware about the service. Reintroduction of the service were noted. The patient phone survey yielded the following results. When patients were asked why they were using mail delivery, the number one reason reported was because the Renton pharmacy closed, at which point, without being prompted, patients volunteered the benefits they obtained from the service. Saving patients time accounted for half of the benefits reported. Saving patients gas and money were a quarter of the benefits. Another quarter said it helped them because they had difficulties traveling to the clinic. Here are some notable patient quotes. Quote, "I do not have a lot of money for anything, and I didn't want to use it for gas." Another patient stated, "Covington, and it takes a while to get to Auburn, and I am not in the best of health. Anything that keeps me going from going out helps." 100% of patients reported that they would recommend this service to others. In fact, some already had. In addition, 95% of patients stated that they would use the service in the future. Here's another patient answer to the question, would you recommend the service to others? You betcha. We should be staying off the road if we can with the heat. It is not good for people to get in their cars, or elderly people, or people on their meds. This service is a no-brainer. With regards to recommendations, there were 2 ways patients learned about mail delivery. 2 of 3 patients learned of the service because their medical assistant, provider, pharmacist, or someone else talked to them about it. A third learned via flyers, handouts, and mailers. There are 2 steps forward. The first step is to educate the HealthPoint staff on the mail delivery service. The second step is to change the patient intake workflow to increase awareness of mail delivery and allow patients to become mail delivery patients during the patient visit. And this is being tested at HealthPoint through an initiative centered on a form titled, "Why Are You Here?" This form is handed out to patients when they walk into the clinic, and through this form, patients write down their chief complaint as well as additional concerns. 2 questions have been added to increase patient awareness of the service as an option for them. Would you like a refill mailed to your house? And do you have transportation issues getting to the clinic? Answering yes to either question will prompt the medical assistant to start a conversation about the service. If the patient has time, they can direct them to the pharmacy with a laminated yellow Fast Pass. The Fast Pass is a tool for the pharmacy to speak more about the service. If they cannot stop at the pharmacy, the medical assistant gives them a handout with helpful tips on how they can use the service.